The health of everyone alive today is being threatened by a persistent fossil fuel addiction that is accelerating climate change and amplifying the harms of the simultaneous crises we face. As climate risks escalate, action to ensure a livable future can no longer be delayed. The Lancet Countdown brings together researchers from around the world to track the health impacts of climate change and the health benefits that will come with accelerated climate action. This year's report shows that all the impacts we monitor are rapidly worsening. Exposure to life-threatening extreme weather events is accelerating. Heat-related deaths among older people have increased by 68% over the past 20 years. Climate suitability for the spread of infectious diseases such as dengue and malaria is rising, and food security is being compromised, with more heat waves resulting in at least 98 million more people lacking access to adequate food than in previous decades. This is putting additional pressure on health systems as they continue to grapple with the devastation of the COVID-19 pandemic. Now, the over-reliance on fossil fuels leaves households vulnerable to the rising energy prices, and the slow adoption of renewables leaves millions exposed to dirty fuels in their homes. And while oil and gas giants are making record profits, a just, healthy transition is undercut by a lack of funding, and governments still allocate hundreds of billions of dollars to subsidizing fossil fuels. Regardless of claims and commitments, the strategies of the largest oil and gas companies would lead to emissions vastly exceeding levels compatible with a healthy future. It doesn't have to be this way. In our response to the concurrent crises, we have a new opportunity to prevent the worst climate change impacts and deliver a healthier, safer, and more equitable future. By redirecting efforts towards rapid and just climate action, people around the world could also feel immediate health benefits. Shifting away from fossil fuels could save 1.2 million lives annually from cleaner outdoor air. Greener, energy-efficient cities could benefit people's physical and mental health, and climate change adaptation could deliver more robust health systems better prepared to cope with future infectious disease outbreaks and climate shocks. The time to act is now. Decision makers must take bold actions to deliver a low-carbon, resilient future where people around the world can not only survive, but thrive. Visit the Lancet Countdown online to find the latest assessment of the state of health and climate change in your country.
It's my pleasure to welcome you all to the launch of the Lancet Countdown for Health and Climate Change's new regional center for small island developing states. The Lancet Countdown on Health and Climate Change began following the Paris meeting, at which an agreement was signed by all UN member states to act to limit climate change to an increase of no more than 1.5 degrees Celsius. Small island states are among the most affected by climate change, though they contribute less than 1% to global emissions. A center focused on SIDS is therefore highly relevant. The regional center is a collaboration between the University College London's Lancet Countdown on Climate Change and Health and the University of the West Indies Caribbean Institute for Health Research. The aim of the center is to bring together academics, professionals, researchers, government officials, advocates, and health practitioners from islands in the Caribbean, the Pacific, Indian, and Atlantic Oceans, as well as the Mediterranean and South China Seas, and to bring them together around the key issues, particularly related to SIDS and climate change. We begin the program with opening remarks from Professor Anthony Costello. Professor Costello is the chair of the University College London's Lancet Commission on Managing the Health Effects of Climate Change. He is also a member of the Lancet's International Advisory Board and board member of the Wellcome Bloomsbury Center on Tropical Medicine. Professor Costello is the director of the Department of Maternal, Child and Neonatal Child and Adolescent Health at the World Health Organization in Geneva. This is a position he has held since 2015, and prior to that, he was Professor of International Child Health and Director of the Institute for Global Health at University College London. His areas of scientific expertise include community interventions to reduce maternal and newborn mortality, neonatal pediatrics, nutrition and infectious disease, and the health effects of climate change. Professor Costello is a founding member of the Women and Children First, a UK-based NGO that implements programs to improve conditions for women and children. And in 2011, he was awarded the James Spence Medal, the highest honor of the Royal College of Pediatrics and Child Health, for outstanding contributions to pediatrics and child health. Following Professor Costello's remarks, we will have a short video on climate change.
Good evening or good afternoon, I imagine, in Jamaica. Hello, I'm Anthony Costello. I'm a pediatrician by training. I'm a professor of global health at University College London. And I've been involved as chair or co-chair of the Lancet Commission and now their annual countdown reports on climate and health action each year for the past 14 years, actually. And it's a huge privilege to me to say a few words about the launch of your regional centre focused on small island developing states. Now, I've been interested in global health since I was a medical student. Why? Because 45 years ago, I spent 3 amazing months in the Caribbean working in a hospital in Vieux-Fort St. Lucia. And I learned so much about the politics, history, and ethnography of the West Indies, as well as a different spectrum of disease. And that experience basically changed my career thinking. I won't go into that now, but until recently, the Lancet Countdown has been largely a global report. But over the past 2 years, we've worked with partners to set up regional centers which can bring their own perspective through their own reports, their own data and policy briefs. And that is immensely important because local and regional voices are far more effective in bringing about change in policy and telling the stories about impact and also solutions to the climate crisis. Now, I'm sure your group will produce fascinating data about the huge challenges that small island developing states face, and also provide ammunition to the politicians in their endeavors to persuade wealthy countries to cut fossil fuels, to cut emissions, to move towards sustainable agriculture, forestry, and indeed health systems. And obviously also to preserve the fabulous biodiversity that we find everywhere, especially in the Caribbean and the Pacific. I was taken on a walk through the tropical forest of St. Lucia 45 years ago, and I saw the St. Lucian parrot, and it gave me as big a thrill as anything I've ever had. Now, every region of the world is affected by climate change, and we know that time is of the essence if we're going to solve this. I wish you every success in your centre, and you can rest assured that the Lancet Countdown Secretariat will support you in your endeavours to produce a stable environment and a future for your children. Thanks.
My name is Dr. Paula Henry. I'm a medical doctor by profession. Initially, I'm a GP for 40 years, but I have recently joined the public health practitioners in fighting climate change. In the Caribbean, hurricanes are really a big problem for us. Because whenever we have a Hurricane 5, what we find is that whole nations can become devastated. And so people lose everything, their lives and their livelihoods. And when we have flooding in the Caribbean nations, healthcare and access to healthcare is challenged. In 2018, we had a very disastrous flood where 1 month worth of rainfall fell in a few hours. We found that there was flooding in the Caroni Plain. That is an area in Trinidad and Tobago that actually is below sea level. People found themselves not being able to leave their home and several feet of water in their houses. During those floods, people lost their food and their medication. In addition to which, because the roads became impassable, they were not able to reach health facilities. What that told me as a primary care physician and as a public health person was that we needed to get on board with the climate crisis. What gives me hope is that we as public health practitioners have seen the importance of educating ourselves, and we are doing this, and we are also going into the communities, working with members to have a solution to the climate crisis. The public is looking to us for solutions, and it is our responsibility not to fail them. We have made a commitment to do no harm, and this is a good opportunity to show that we are the ones to make the initial change.
I'm not sure if you can see me. I think the host has to enable me to share. Thank you very much. Thank you very much. We're now going to have a brief presentation on the 2022 Lancet report for the countdown. This will be by Dr. Marina Romanero, the Executive Director of the Lancet Countdown for Health and Climate Change. Dr. Romanella is a climate change and health researcher at the University College London. She trained as a clinical biochemist at the University of Buenos Aires, Argentina, and has a PhD in biomedical sciences from the University of Cambridge, UK. As a consultant for the NHS, she's led a team of researchers in developing its net zero commitments, and as a member of the working group on the health co-benefits of climate change mitigation policies of Italy's Superior Health Council. So I invite her now to make her remarks on the most recent Lancet Countdown report.
Hi, everyone. Thank you so much for having me here. I'm Marina Romanello. I'm the Executive Director for the Lancet Countdown, and I'm truly delighted to be here at the launch of our Small Island Developing States Center. Thank you so much to Georgiana and all the team for working so hard in making this event happen. I'm going to share with you some of the findings of our latest Lancet Countdown report, which we published in the Lancet in October this year. And I'm going to just share some of the key findings and then hand over to our colleagues at SIDS to explore a bit more this intersection in small island developing stage, which are so crucial to the climate change and health conversation. So the 2022 report of the Lancet Countdown, we published it just a few weeks ago in the Lancet, and it's the 7th report in the iteration of the Lancet Countdown, with over 40 indicators monitoring the health impacts of climate change, and importantly, the health opportunities and co-benefits of climate action. It is the product of the work of almost 100 researchers from 51 academic and UN agencies from every continent around the world, so truly a collaborative effort. And the main finding that comes from our report this year is that we're seeing the world under a persistent fossil fuel addiction. And this addiction is not only driving and amplifying the health impacts of climate change, but also compounding with other coexisting crises like the energy crisis, the cost of living crisis, the food crisis, to exacerbate the overall impacts on our health. So just to show you, and I don't expect you to absorb all of these indicators, but just to show you some of the findings from our indicators that monitor the health risks and impacts of climate change. We're seeing that across every dimension monitor, things are getting worse really rapidly. And you can see that through the increasing impacts that we're seeing here in every indicator. We're seeing an increased exposure of vulnerable age groups to heat waves that put their lives at acute risk. We're seeing also that labor capacity is being lost as a result of the rising temperatures, and that is now leading to a potential loss of income that compounds with the current cost of living crisis and economic crisis to undermine the socioeconomic determinants of health, also posing indirect impacts of climate change on health. We're seeing also that climate change is threatening our food and our water security. And particularly for the first time this year, we're monitoring an increase in self-reported food insecurity that is associated with heatwave events, with almost 100 million more people self-reporting food insecurity in 2020 that were linked to heat waves than in baseline years. We're also seeing extreme weather events becoming more deadly. We're seeing an increased exposure of populations to days of extreme wildfire danger, obviously with wildfire posing an acute risk to health. And we're seeing the climate conditions becoming more and more suitable for the transmission of key infectious diseases like dengue, malaria, Vibrio. So these are spreading to new locations. But besides seeing an increased health impact and health risks of climate change, we're also seeing that our addiction to fossil fuel is leading to direct impacts due to the low adoption of clean renewable energies. We're seeing that globally, only 69% of the population has access to clean fuels and technologies for cooking, and that percentage falls to just 13% of the populations in low human development index groups, the most vulnerable populations. And for the first time, we're monitoring the air quality in people's homes, and studying 62 countries, we're seeing that the level of PM2.5 air pollution, the most dangerous form of air pollution, exceeds by 30 times the levels compatible with the WHO thresholds inside people's homes in these 62 countries. So because of the use of dirty fuels, mainly biomass, fossil fuels, people are breathing toxic air inside their homes, and this could be avoided through a transition to healthy zero carbon technologies. And what we're seeing now again is a compounding effect with the current energy crisis, whereby the cost of living, the energy and the rising energy prices are pushing people more and more to the use of dirty fuels, particularly biomass in their homes. So the risk is that the exposure to air pollution inside people's homes will increase even further with long-lasting impacts to their health. And despite the increased impacts of climate change and the health impacts of our overuse of dirty fuels, governments and companies are still prioritizing the interests of fossil fuels to the detriment of people's health. We're seeing that since 1992, the year that countries came together and committed to avoiding dangerous climate change, the carbon intensity of the global energy system has decreased by less than 1%. And the energy system is the biggest single contributor to greenhouse gas emissions. And most concerningly, the energy consumption has also increased at the same time, which has meant that CO2 emissions reached a record level in 2021, and that energy-related emissions again reached record levels this year in 2022. So we're not only not decarbonizing, but we're actually moving in the wrong direction. And we have some hints of what are the drivers of that. We're seeing that in the 86 countries that we've analyzed, 80% of them are still providing overall subsidies to fossil fuels, providing financial incentives for the continuing use of fossil fuels. These 80% of countries allocated a total of $400 billion to fossil fuel subsidies in 2019 alone. And this is while countries have not yet managed to deliver the $100 billion that we committed in 2009 to promoting a healthy, just transition. But 4 times more is being allocated to fossil fuel subsidies. And perhaps more concerningly, the amount of funds that many countries allocate to fossil fuel subsidies is comparable to their total health budgets. In 5 countries, it exceeds the total health budgets. So we're prioritizing fossil fuels over our health systems. And when we look at the private sector, particularly fossil fuel companies, we're seeing that 15 of the largest oil and gas companies are today taking strategies and investments that would lead to them exceeding by over 100% the levels of emissions compatible with the Paris Agreement, with a healthy future by the year 2040. And this is obviously of particular concern now, as these companies are making record profits as a result of the high energy prices. And they now, because of those windfall profits, have the opportunity of redirecting their efforts and their investments towards zero carbon energy solutions. But unless they do that, they will lock us into a future of increased and potentially catastrophic health impacts. So the world today faces a critical juncture. As countries are trying to devise a response to this compounding crisis, the energy crisis, the cost of living crisis, the climate crisis, and the health crisis of COVID-19, going back to the use of fossil fuels, committing to long-term fossil fuel extraction and use, will lock us into a future of potentially catastrophic health impacts. However, there's now a new opportunity. Countries can now align the response to the climate crisis, the economic crisis, and the climate change and the cost of living crisis in a cohesive manner that prioritizes health and well-being of the local populations. And by doing so, we could see countries promptly transitioning to zero carbon energy that could be produced locally, could reduce energy poverty, and could build resilience on our energy system by reducing our reliance on the fossil fuel markets that we've seen are so volatile and so sensitive to geopolitical conflicts. In doing so, we could also avoid over 1.2 million deaths that result today from the exposure to fossil fuel-derived ambient PM 2.5 air pollution. We could also provide better systems, particularly in urban transport, healthier cities that are focused around people, with more green space and all the mental and physical health benefits that that brings, and also the local adaptation benefits of increasing urban green spaces. And we could also transition our diets to low-carbon plant-rich diets, and that could save up to 11.5 million deaths each year at a global level from the overconsumption of red meat, low consumption of fruits and vegetables. So today, countries can take the decision of a health-centered, aligned response to the compounding crisis, and they would not only avoid the worst and most catastrophic health impacts of climate change, but also deliver healthier environments, healthier cities in which present and future generations can thrive. So with that, I invite you to visit lancetcountdown.org, where you can download the report. You can also download the policy brief for small island developing states that we're launching today, and I'm sure you're going to hear more about that later. And invite you to visit also our data platform, where you can explore a bit more of our indicators in more detail. And with that, I thank you very much for your attention, and I hand over back to the organizers for the rest of the event. Thank you very, very much for listening.
Thank you, Dr. Romanello. And it's now my pleasure to introduce Dr. Georgiana Gordon-Strawn, who is the Executive Director of the new center. Dr. Gordon-Strawn holds a PhD in biochemistry from the University of the West Indies and an MSc in health policy planning and financing from the London School of Hygiene and Tropical Medicine. She was the 2019 recipient of the UWI Vice Chancellor's Award for Excellence in Research and is a former director of the university's Mona Office for Research and Innovation. Georgiana is currently the director of the Tropical Metabolism Research Unit, a unit within the Caribbean Institute of Health Research. As I said, she's the executive director of the Lancet Countdown's Health and Climate Change new regional center for small island developing states, and will speak today on some of the implications of climate change for these small island developing states. She'll also introduce a new policy brief which has been produced concerning small island developing states. Following this, we'll have a panel discussion which Dr. Gordon Strawn will chair. So over to you now, Georgina.
Thank you. Thank you, Professor Walker. I'm being asked to start my video. Just want to check with that I should start my video. I thought I was supposed to share screen. Okay, I'm going to go ahead and start. My apologies, just trying to get some of this out of here. Okay. All right, thank you so much. Good day, good morning, good afternoon, good evening, depending on where in the world you are. We're so happy that you could join us. And it is my duty to just take you through a few slides, which will look at the small island developing states, some of the challenges that we have, and then to just do, I think, 3 slides where I will summarize the policy brief, which you can read in full at the link that will be provided at the end of my presentation. So I want to start by setting the context, and I will say without any form of bias at all, that I think small island developing states represent the most beautiful places in the world. We also have diverse cultures. We have indigenous peoples, and we have several other cultures that make us so rich. And beyond that, we are among the most biodiverse places in the world. There are about 52 small island developing states, and I'm speaking specifically about the ones that are members of the United Nations. And we actually make up about 65 million of the world's population. So to give you an idea of our geographical spread, which as you can see is quite wide, we have small island developing states within the Caribbean, which are the orange dots here. We have around the Atlantic and Africa, the Indian Ocean and South China Sea. And these are around the blue dots here. And then the green dots over here and the R dots are the islands of the South Pacific. As small islands, we are particularly vulnerable to climate change. And this is partly due to our size, but it's also due to the fact that we're geographically placed in regions that have high exposure to natural hazards. We're very climate sensitive. And this little chart over here shows all the areas, at least not all, but quite a few of them. So we're sensitive to temperature, we're sensitive to air quality, water quality, sanitation, food security and safety, coastal erosion, infrastructure, and extreme weather. Now I wanted to just do a little look back at how it all began and how we got involved with the Lancet. As Professor Costello, Anthony, said earlier in his presentation, the Lancet had started to launch out into the rest of the world trying to look for more local and regionally relevant information, and had taken a strategic shift in setting up regional centers. So Small Island Developing States was one of those centers that they thought would be a great idea. And so in December of 2019, there was the launch of the Lancet Countdown report for the Caribbean, and it was held in Bridgetown, Barbados. And the discussions around setting up a Small Island Developing States regional center for the Lancet Countdown for Health and Climate Change started there. Now, in true Lancet style, the first thing that's usually done is what is called a scoping exercise or scoping report. And the objectives of the scoping exercise were firstly to try to identify the challenges and the priorities for states regarding health and climate change, and also to determine the relevance to states of the existing Lancet countdown indicators. The third objective was to see whether or not modifications and possible additions to the indicators would increase or improve their relevance, that is the relevance of the indicators, to Small Island Developing States. And then finally, to look at the capacities for research and collaboration within Small Island Developing States. Now, this scoping report was launched in June of 2021. And here are some of the findings. So just wanted to give a brief background. We actually interviewed more than 30 stakeholders within the Pacific and the Caribbean states. And we looked at the different indicator areas, and they spoke to us, they told us whether or not they thought it was relevant, and they gave some reason for their, for their decision. So the first indicator area, which looked at health impacts of severe weather events, was obviously important and relevant. And the stakeholders thought that we needed to look at the health impacts following cyclones, looking at, including in this, injuries and illness from both communicable and chronic non-communicable diseases, which result from damage to infrastructure and to health systems. They also thought that while we had a good system of monitoring cyclones, we needed to improve our monitoring on other climate events, such as heat waves, floods, and droughts. The indicators on the vector-borne diseases were also thought to be very important. Given the context of some states with weak sanitation systems, warmer temperatures, and severe unpredictable weather patterns that actually promote the spread of vector-borne diseases. Water, sanitation, and hygiene, WASH for short, was also one of the indicators thought to be one of the theme of indicators thought to be really relevant to states. And for us, it was particularly relevant because we are already, most of us, water insecure. And so the access to the clean water that we have, which is already scarce, is threatened by saltwater intrusion of our aquifers, damage to our infrastructure from severe events, and also contamination as pathogens proliferate within these sorts of systems. Now, you would know that we couldn't get out of this without talking about non-communicable diseases. So this came up as one of the key indicators that needed to be monitored by the stakeholders. They lamented the loss in biodiversity and local food production in SIDS, and the increased reliance of SIDS on processed foods. And we all know that there is an association between consumption of processed foods and chronic non-communicable diseases. Now, this is a bit sad because one would think that we're mostly in the tropical zone, and therefore we should have all these great, nice fruits and vegetables, but we are seeing an increased reliance on processed foods. Another set of indicators thought to be important was one relating to the collaboration between agencies. It was thought that our agencies do not speak to each other enough. So the health sector doesn't speak enough to the meteorological sector, and other agencies which are responsible for planning, infrastructure, disaster management, and energy are not talking to each other. So there needed to be a system where we could look at more collaboration between our agencies. Of course, research and surveillance linking climate and health was one that was thought of as important to the stakeholders. They spoke about especially the need for doing forecasting and also modeling of diseases. And they thought that we needed to strengthen our health surveillance system. Investment in surveillance and research, another area that was thought of as very important. And for this, there was a plea and an actual beg for funding to help with the routine capture of data and analysis of these data and reporting of these data within the state. They also thought that we should look at building academic programs which would build out our human resources. Government engagement in health and climate change was another indicator, and the stakeholders more or less said that they needed governments within SIDS to measure the action that is being done to adapt systems, existing systems, to help with the prevention and to also help with the treatment of ill health that is arising from climate change. So out of that, the regional center now had a framework within which to build. And we set as our goal to bring together institutions in the Caribbean Sea, as well as institutions in the specific region and within the region spanning aims. And aims, as I said before, include Atlantic and Indian Oceans, Mediterranean and South China Sea, and to bring them together on key issues that relate to SIDS and to the health and to climate change and its impact on health in SIDS. So we have two main mechanisms that we're using. One is to try to strengthen collaboration within the SIDS, and through this we're intending to build out a network of SIDS professionals and agencies, and we will interface with policymakers, members of academia, health, climate, and research organizations. And our second objective, or second strategy, is to try to provide climate health adaptation strategies, information around that from the perspective of climate and health data, from trying to prioritize climate and health within the policy arena, and then to look at sectoral capacity and assessments within SIDS. So just to give you a few words about the policy brief, and of course it's a brief, so it's short, and I'm going to give you a summary of the policy brief. So my summary will even be shorter than the brief, and I encourage you to have a look at it and to give us your feedback. So I want to start with a little bit of context, and I also want to add that all the information that I'm presenting here actually came from the Lancet countdown indicators. So just to start out, to say that states have been affected by extreme climate events. And I know in saying that, I'm not saying anything new, but I want you to look at the number of people who have been affected between 1980 and 2021. And this is 59 million people. But more importantly, because we may see 59 million span over 20 years may not be such a big deal if we're cynical, but half of those people, half of the 59 million were affected in the last 10 years. And I think that this is important and significant. The other thing that I'd like to bring to your attention is one which is more of a case study. And this is looking at Hurricane Maria, which affected Dominica in 2017. Now that hurricane caused 37 fatalities. It costed 226% loss in GDP. The agricultural sector was pretty much wiped out. And more than 90% of buildings were damaged. And this included all health facilities. I want to switch a little bit to talk about our access to fruits and vegetables, because I mentioned that earlier, and this was something that the stakeholders brought up about our increased reliance on processed foods. Now, the Lancet has an indicator, which is indicator 3.5.2, which actually looks at the percentage of total deaths which are caused from imbalanced diets. In 2019, for the Caribbean SIDS, this was 14.6%. And for the Pacific states, this was 9.9%. So 9.9% of total deaths are caused from imbalanced diets. States already bear a heavy burden of chronic non-communicable diseases. In the World Development Indicators, a database published by the World Bank Group, when we looked at data for 2017, what we found was that 60 to 80% of deaths in SIDS was caused by a non-communicable disease. 60 to 80%. Now, what we know is that climate change will only make this worse. It will exacerbate the condition. It will make us have more NCDs. And so we really do need to tackle climate change, and we do need to tackle NCDs. Vector-borne diseases is something I think we're a lot more familiar with. But what we know is that climate change is making weather conditions increasingly favorable for the transmission of these vector-borne diseases. If we use dengue fever as an example, what we've seen for both the Pacific and Caribbean states is that we have overlapping strains as well as emergence of new strains. We also know that our outbreaks are more frequent. So in the past, we used to have a dengue outbreak of 1 in every 10 years. Then we would have 1 in every 5 years. And now we're down to every 3 years, and for some countries, almost every year. The Aedes aegypti mosquito is one of the vectors that carries dengue fever, and the climatic suitability for its transmission has increased by 11.5% when we compare transmissibility during the period 1951 to 60 with the period 2012 to 2021. What's also important about this is that the length of the transmission season for dengue has increased to 8 to 12 months, 12 months almost all year round for many Caribbean and Pacific states. So I'm going to speak a little bit briefly about the recommendations that came out of this brief. Now, one of the first things that we thought we needed to do, given the statistics and given the information that we had, was to look at adapting health facilities in SIDS. We think that this is an important recommendation. And when we're looking at this, we are looking at it from two perspectives. We're looking at the planning of public health emergency responses, and we're also looking at financing for public health emergencies. Now, most countries in SIDS are at a level 4 when we use the International Health Regulations capacity implementation as an indicator of public health emergency readiness. However, for financing, about 25% of the countries actually apply an ad hoc financial allocation when there is an emergency. Now, while that may be the best that the country can do, given the frequency and the unpredictability of what we expect to happen, it may be wise to have funds allocated for public health emergencies. So the recommendations that we've made here are, one, to improve public funding for responding to public health emergencies, direct resources towards building climate resilient health facilities, and allocate resources to essential healthcare services during and after climate emergency. The other recommendation that we thought about looked more generally at climate sensitive diseases, but also focused in on non-communicable diseases because of the burden that they have placed on small island developing states. Now, we know that there has been an emergence of what has been called syndemics, and this is where we have synergistic effects, where we have two epidemics or the determinants of one or more disease happening at the same time. in our climate sensitive disease surveillance, we're a bit hampered because in some situations, there's not an integration between the climate sensitive disease or its health risks and meteorological surveillance. Also, there are other climate sensitive diseases which go under monitored or unmonitored. And these include heat-related illnesses, mental and psychosocial illnesses, and for some countries, air pollution and illnesses related to air pollution. So the recommendation here is to develop climate and health observatories, or if you prefer, stronger surveillance systems for NCDs and other under-monitored or unmonitored climate-sensitive diseases, and also to allocate financial resources to building improved health data systems integrated with meteorological information. The last recommendation looks at climate-integrated early warning and response systems, and it concerns the trends in vector-borne diseases, which I alluded to earlier. We also wanted to look at preventive actions for vector-borne diseases. So we know that public health interventions sometimes wait for a confirmed case. They're reactive rather than proactive. And we think that the implementation of early warning and response systems with integration of health and meteorological data for these vector-borne diseases and other climate-sensitive diseases would be a good idea. So we would also recommend that we develop public health interventions and communication campaigns with these response systems in mind, with a focus on vector-borne disease. So I close with a little bit of hope. At COP27, which was held just a few weeks ago, two great things happened. One was an agreement for a loss and damage response for vulnerable states, including SIDS. And this is something that SIDS were negotiating for more than 30 years. So it's good to see that at least an agreement has been reached. Also, Antonio Guterres, the UN Secretary General, announced a $3.1 billion allocation for the development of early warning systems, announcing that he wants to have early warning systems that cover every person. So I close with these two hopes. And I am also hopeful that the framework that will be used for administering these funds will be easy, equitable, and will reach the most vulnerable people. I would like to thank you for your attention, and I would like to just acknowledge the Wellcome Trust for funding the work of the Lancet Countdown, of which we are a beneficiary. Thank you for your attention. Let me stop share. I think we want to show you where you can find the policy brief. So I'll ask that be shared. So it's also in the Dropbox in the chat. So if you can copy the link, you can definitely go to it so you can see more of what was discussed within the policy brief. Thank you. So we're going to move merrily ahead from this point into what I think is a more interactive part of this launch. And we are going to go into our panel discussion. So we're very, very pleased to have a distinguished and diverse set of panelists and experts with us today. It's my pleasure to actually introduce them. And so what we're going to do first is I'm going to tell you who they are, and then I'm going to do it one at a time, and then they're going to do a brief presentation on their work, and then we will go into a question and answer session. Audience, you're asked to drop your questions in the Q&A, and we will pull from them as we go through this panel discussion. So I want to start the panel discussion by introducing someone who I'm very proud of, and I would like to consider a good friend, and this is Professor Tanisha Stevenson. Professor Tanisha Stevenson is an environmental physicist, and she's the head of the Department of Physics, and I'd like to say the first female head of the Department of Physics at the University of the West Indies. She's in the Faculty of Science and Technology. She has been recognized internationally as a climate studies expert, and she currently serves as contributor and lead author for the United Nations Intergovernmental Panel on Climate Change. And she has contributed to the 6th assessment report. Professor Stevenson holds a first-class honors in physics as well as a PhD. And her research area includes environmental physics, as I said earlier, climate variability, climate change, and climate extremes. She is the co-director of the Climate Studies Group at the Mona campus of the University of the West Indies. And it is my pleasure to present Professor Tanisha Stevenson, who will talk to us a little bit about, she'll give us, I think we need the context, we need the background, we need to know what the science is saying. So we thought it really important to have Professor Stevenson with us. Professor Stevenson, please go ahead.
Thank you so much, Doc, for that introduction. Can you confirm that you're hearing me, please?
We are hearing you very well.
Good afternoon, our colleagues. We want to speak a little about current and projected climate change trends in states, the climate science perspective. So I'd like to look at a number of things that we already face as small island developing states. And the first is we want to look at the multiple hazards that we are already experiencing. So we want to speak to quickly that we're already seeing intense rain events and an increase in the amount of rainfall we have in some of our intense events. And so the first panel shows us the blue, showing us increases across the Caribbean. We've been having more intense storms, and that's the bottom panel. What we have also been seeing is heat extremes globally have been increasing. These are the red hexagons. And when we look at some of our small island developing states, we are also seeing the increases. And there's medium confidence that the increases we're seeing in heat extremes are due to our own activities. The bottom panel looks at annual temperatures between 1961 to 2015 across 2 different data sets. And globally, we're seeing increase in temperatures. And for small islands, the rate of increase is about 0.15 to 2.2 degrees per decade. So more hot extremes, hotter temperatures, and we are seeing sea level rise. As we look at climate change, we want to suggest number 2 is that our change is going to amplify as we move into the future. So even hotter times ahead, as we look across the Caribbean, everywhere in the Caribbean warming, for some scenarios up to 4 degrees, and almost every day in the future will be considered warm days in comparison to how we characterize them today. We're looking at even drier conditions, particularly in our rainfall season. And so where we expect to have replenishment of aquifers, that's when we're going to be drying, and a lot more dry, though we still have the variability. Even higher sea levels and more intense storms, so higher rainfall rates and stronger winds, more rapidly intensifying systems, as we are already seeing. Generally fewer systems, but the intensities will increase. And there are substantial differences across small island developing states. We can also speak to drought occurrences, and our projections are we will see more drought events and the severities of the events will increase. So the third thing we want to note is, boy, this suggests compounding risks across the globe, and particularly for small island developing states. And for us, the focus today is health. And so one of the things coming out of the IPCC, the Intergovernmental Panel on Climate Change, and the 3 assessment reports that were covered, that were released between 2021 and 2022, is that we're going to be seeing simultaneous extreme events. They're going to be compounding what we experience, the risks that we're exposed to. So the hot and dry, producing heat stress among farm workers, impacting on crop productivity, impacting on agriculture, livestock yield, impacting on food prices, and we have already heard the cascading impacts that will have on us and food security. The other thing we want to note as we look at compounding risks is that even at 1.5, which we have advocated for, we're still going to have globally deadly heat waves in city, compromised safe work activity, increases in the geographic coverage or range of the Aedes aegypti and other vectors, decreases in nutritional quality, more undernourished events globally, and even greater exposure to deadly heat. And so what it brings us to is a response, and I will close here. Adaptation is one of the responses we speak to. We have already committed to some warming. We're going to feel those impacts. How can we position ourselves to better treat with these impacts? And other panelists will speak to this more conclusively. For example, later on, you'll hear about green spaces and adaptation, and bring to bear that the impact of those adaptation strategies on good health. Some of our sustainable development goals are also achieved. And finally, then we can't forget the mitigation picture. Even though we are not the main contributors, even though we are put at 1% or 0.6% of the 2019 global emissions, the small island developing states are still seeing ourselves as part of the solution, and mitigation is still on the table. And you will see efforts within our region to also mitigate and decrease our greenhouse gas emissions. Thank you, colleague. Back to you, Chair.
Thank you so much, Brooke. That was an excellent summary of doom and gloom.
I'm sorry.
But that's okay. We have to adapt and we have to mitigate, and we have to know what we're up against so we can know what to do about it. And obviously that brings me right into our next presenter. And our next presenter will give us a little more hope, because he's going to be talking about energy and health co-benefits. His name is Dr. Harry Kennett, and he's a senior research fellow at the Bartlett School of Environment, Energy and Resources in the Faculty of the Built Environment at the University College of London's Energy Institute. He is a podcaster. He hosts the Climate Change and Health podcast for UCL, and this examines the relationships between climate change and our health. His research has centered mainly around the relationships between energy, the environment, and health, and he examines these relationships within the context of the built environment. In 2020, he has been the research fellow for the Lancet Countdown's Mitigation Actions and Health Co-Benefits Working Group, and he has contributed to the research and production of yearly reports since 2020 at both the global and regional level. And it gives me great pleasure to hand over to Harry as he tells us all about health co-benefits and energy, using the lens of through the lens of SIDS. Thanks. Please go ahead.
Thanks very much, Georgiana. That was a very lovely introduction, and yeah, it's a great pleasure to be here with you all. I'm currently in Scotland, so it's it's the evening session for me. I'm just going to talk a little bit about, and I'll keep things brief because I know we have the panel discussion in general coming up, but I really wanted to highlight in researching what I wanted to sort of say in this session. I was struck by fundamentally the diversity of what the SIDS nations have in terms of their energy mix and the makeup of the nations and the struggles that they'll face in the the coming or present climate crisis. And so I just wanted to sort of highlight some of those points because I think they're quite central to the way that we can understand the relationship between energy and health. So I will share my screen. I have a very a very boring slide, I'm afraid. It's not no way as good as the ones we've already seen. Oh, that says leave webinar. Don't press that one. There we are. Share. Okay, so hopefully on the screen you can see this table, which I just wanted to rattle through. I focused here on the top 7 most populous countries amongst the SIDS nations. As Georgiana mentioned earlier, there's a lot of nations in the SIDS group, and so that makes summaries difficult outside the context of some of the direct climate challenges that we just heard about. In terms of the energy mix and what that means for the population, I think that the first thing to highlight is the vast differences in how much electricity is used on a daily basis. So if we zoom in initially on the Dominican Republic, in the first row there, you can see that 5 kilowatt hours per day per person is about it's a very similar number as Cuba and indeed Jamaica's average consumption. So that gives you sort of if you have experience of these countries, a ballpark sort of sense. But if you then look at Haiti, you're right down at 0.2, and Guinea-Bissau much less than 0.1. And so that really gives you an initial indication of some of the massive differences that we see here. Part of that is explained by the next column, which is access to electricity. And in many SIDS nations, that's above 90%, essentially universal access. But certain countries, Papua New Guinea, Haiti again highlighted, and Guinea-Bissau, that's much lower than we'd like it to be. And the resultant impacts, and I don't want to say that there's direct correlation between life expectancy and electricity use, but it's certainly something through which many of the relationships between energy and health and climate change are mediated. You can see that the countries with the lowest life expectancies tend to have the lowest access to electricity. And so that manifests itself in a sort of a daily basis, as many of you will have experienced in terms of extreme weather events and the insecurity of supply that happens in those events. And that will have knock-on impacts for things like keeping the lights on in hospitals, and keeping medications at the correct temperature to be used in the weeks after an event. So there are countless ways in which that relationship is mediated. The final thing I then want to highlight is just this percentage of fossil fuel mix, which is in the makeup of many of the SIDS nations. The real underlying notion there is something surrounding independence, which is obviously something which has been historically and currently incredibly important for SIDS nations. And this, the real contrast, or the real sort of the thing to highlight, is that the vast majority of SIDS nations, you can see in the total column at the bottom there, 94% of the electricity in SIDS nations comes from fossil fuels. So in terms of, there are two sort of elements there which are important to think about. One is the carbon emissions, which is, in my view, for SIDS nations sort of secondary. That the primary issue is the reliance on imports and how there are opportunities, therefore, for massive increases in the independence of supply in SIDS nations. So I'm thinking about sort of robust renewables. You can see Papua New Guinea is an interesting one, that it has only 41% in its mix. That's because Papua New Guinea's got quite a large amount of hydroelectric generation. Those sort of solutions aren't necessarily available to all SIDS nations. And so these are just some initial thoughts on how energy and health are intertwined, and some of the very specific challenges that the small island developing states face. So with that, in the view of keeping things swift, I'll pass back to Georgiana, and thank you all very much.
Thank you so much, Dr. Kennard. That was quite interesting. What I'm taking home from this is, and I know that you're not saying that there's a direct relationship. I know that you're probably not saying that there's a direct relationship, but the impact of, or the association between life expectancy and access to electricity, or I could probably be more general and say access to well, I don't want to say access to energy, because there may be access to different forms of energy.
Yeah, exactly.
So I leave it, as you said, to electricity. So thank you. That was an interesting presentation, and certainly quite informative for me, especially looking at the health part with life expectancy and access to electricity. We're going to move swiftly along, and we actually have our next presenter, Professor Michelle Maiku. And I'm very pleased that Professor Maiku was able to join us today. Very, very happy. I won't tell you where she's coming from, fresh from, but I'll just give away a little secret to say that she was in dialogue with her members of parliament in Trinidad and Tobago, so she's quite influential in that way. So thanks for joining us, sir. I'm just going to say a few words about her. There's so much to say. She has done so much in her very young life. So she's a professor of urban and regional planning in the Department of Geomatics, Engineering and Land Management at the University of the West Indies. She holds a PhD in urban planning from McGill University. And her first degree was in geography and the social sciences, which she did at the University of the West Indies in Mona. Professor Maiku has been the recipient of several awards and several scholarships. And in 2014, she actually received the University of the West Indies Guardian Group Teaching Award for Teaching Excellence. Her real role here today is to talk to us a little bit about urban planning and greening and adaptation strategies that we can apply for improving the climate adaptation of our cities and of our countries. But I wanted to just say this before I allow her to speak. I really need to say that she is a coordinating lead author for the Small Islands chapter, which is chapter 15 of the 6th assessment of the Intergovernmental Panel for Climate Change. So Professor Maiku, over to you.
Thank you, Georgiana. Thank you. I want to share my screen, so let's see what's happening. Okay. Oops. Can you confirm if you are seeing my screen? Right, here it is. Can you confirm that you are hearing me as well?
Yes, Prof. We're hearing you very clearly.
Okay, great. Excellent. Thank you. So my presentation today deals with urban green spaces and adaptation to adaptation planning. And I think that Professor Stevenson already did a great job of synthesizing the scientific findings of the IPCC reports, essentially that small islands, we have seen common changes in terms of observed warming, and that the warming will continue into the 21st century, further increasing heat extremes and heat stress. That we are facing some changes in terms of sea level rise, and we expect this to be to accelerate with higher carbon emissions over a much longer period of time. And so the window of opportunity is closing for us, high confidence, as we found in our report, and that accompanying this could be increasing tropical cyclones within the region, particularly in terms of intensity and in terms of accompanying storm surges, which will affect our urban areas. It's quite clear to us that in our Caribbean cities, we are seeing health impacts. All of the factors I highlighted, rising temperature, sea level rise, flooding, and so forth. These are all causing issues related to psychological trauma, the loss and damage resulting from the impact of hurricane activity and storm surge on our urban infrastructure, and that also has psychological impacts and public health impacts. I think moving more towards the solution aspect, which is what my focuses today is to emphasize the value of blue-green infrastructure and the role of urban planning in accelerating such action to addressing the issues with respect to greening in cities. So essentially, we're talking about a simple philosophy of designing with nature. In the Caribbean context, we see that urban green open space does exist in our cities, but it's a hidden wealth found in our cities. Many of our colonial capitals were built by the Spaniards, and they also always had the center square or the city square or Zocalo as we know it within the urban area. And on one of my trips to Havana, I'm very impressed with what Cuba has done in terms of the work it's doing in its cities. You see that the urban park is there to reduce the heat stress that people are experiencing. It's well used by all age groups. And they are attempting to do a lot of landscaping to increase the foliage within the urban areas to reduce the heat stress. In the Caribbean as well, what we are seeing is that we do have waterfronts and we do have urban parks. This is a photograph of the Caranage in Bridgetown. And so that waterway does have an ameliorating effect on temperature. And this is the Botanic Gardens and the Savannah area as we know it in Port of Spain, which is a huge open space, which also has the value of reducing the urban temperatures. The urban parks do also play a role in mitigating flooding. You would be surprised to know how foliage can reduce the impact of rainfall and slow runoff so that we don't experience expansive flooding in our capital areas. So I also wanted to highlight that there are green spaces in urban areas and in coastal urban areas. And this is an example of where an attempt has been made to do adaptation planning in Barbados, where coastal defense is built to save the coastline, but also there is a greening and landscaping effect to have an improved aesthetic value. And it also has a public health impact in that many people use the boardwalk, as it's known, for recreational purposes and for exercising and so on. So there are many co-benefits, all right, derived from urban green spaces. But it is also interesting to note that we do see in Haiti, and one of the panelists that preceded me spoke about Haiti, there has been a severe loss of green infrastructure. This has been consistent over many, many decades. And what we are seeing in the main cities and throughout Haiti is severe flooding that's occurring as a result of the denudation of its hillside areas and of the greenery that existed. And this, as I say, has been quite persistent. So we talk about green spaces. We also need to look at the traditional architecture, and the vernacular architecture does provide an opportunity to provide shaded areas. So this is an example of Havana where this has been done to provide shade during the midday heat and so forth. I've also been exploring the value of underground infrastructure corridors. Above ground infrastructure is impacted by hurricanes. And if we put the infrastructure underground, what we can do is have it double as green spaces in urban areas while giving us some degree of resiliency, ability to recover once we have these urban infrastructure corridors buried below, as opposed to being above ground. We also have an interesting use of vernacular architecture where we can beat the heat stress from the design of our the actual housing or dwelling units. These are vaulted windows, jalousies that emit heat and so on. So in the urban setting, we can explore how we can use urban gardens and urban architecture to cope with the heat stress that we are likely to encounter, as well as the heavy rains once we have these garden or landscape spaces. So there are things in the Caribbean that we can explore. The question is, how do we promote them? So it's the how. We can do an integration with spatial plans and policies, ensure that sectoral policies are synergistic with those spatial plans and policies, try to enhance public-private partnership, access possible finance to fund these types of urban spaces if we are afforded the opportunity to do so, and to use a multidisciplinary approach of architects, land use planners, engineers, etc., and also use stakeholder engagement to come up with local and indigenous knowledge and community knowledge in terms of how we've coped with the urban stresses within as a result of climate change. What I would say is that we are seeing the changes. We have to now look at less concrete and asphalt surfacing, use more trees, parks, green belts in our cities. There's an urgent need to select and establish low maintenance tropical trees with broad canopies. And we need to look at the blue belts, riverways, waterways, waterfronts, which can double as recreational space. And I will conclude by saying, if we look at a more compact urban form, where we go for more medium density development, then we can have low carbon urbanization, less commuting from peri-urban areas to the urban areas. We can also promote more urban density, which would save our rainforests and watersheds, which actually protect us during the flooding that occurs within our cities now. And that will also help improve water resource management, which will be instrumental in terms of water security and public health. And what I would like to say is, in the Caribbean, in closing, we have been using all of these measures. They are not new measures. I think we have retreated from the use of our traditional measures, and we need to revisit what we have been doing in the past and bring it into the future, as we say, back to the future, to explore ways of achieving transformation and to promote public health. On that note, I'd say thank you, and over to you, Georgiana. Thank you.
Thank you. Thank you so much, Professor Maiku. That was a very interesting presentation, and always amazed that we already have the answers, but we have decided to divert to other designs. I can speak for Jamaica. A lot of our buildings, our new buildings, have a lot of glass and palm trees. Palm trees, I don't know if it's the gardeners who don't like to rake the leaves, but the lovely canopy trees that you could play under, swing under, they're all gone, and now we have palm trees. And so I think we probably need to look back at your I think it was your second to last slide, which was talking about how do we do this, because we really do need to shout this out loudly, especially with the expanse of building and construction that's been going on, especially I know within this particular region, within the Caribbean. I probably can't speak emphatically for small island developing states, but thank you so much for your presentation. And I'll go swiftly to our next presenter. And our next presenter is from the Pacific, and this is Dr. Roani Shiu. And Dr. Roani is actually a human geographer, and her work focuses on Pacific health education and sport in Australasia and the Pacific region. Her PhD focused on the Pacific health workforce development by examining the health and education inequalities and inequities in Pacific communities in New Zealand. She is a convener of Pacific Studies, and she provides academic leadership to Pacific Studies at the Australian National University, ANU, and the ANU Pacifica Australia Equity and Outreach Program. She's also been involved in a range of research projects, including sports diplomacy and development, leadership in the Pacific, elections and politics in Samoa, and cross-cultural research for Pacific labor mobility. And Dr. Rani is going to have a chat with us about the situational report for the Pacifics, but also to talk to us a little bit about how heat adaptation practices and strategies and programs have been working in the South Pacific. Rani, over to you.
Malo Lesoi Formoa and talofa love everyone. Kia ora from Aotearoa, New Zealand. I'm currently with a co-director with the Centre for Pacific and Global Health at the moment. So the work that I'm talking about is actually being done with the University of Auckland. And my work to date has focused on the health impacts of the climate crisis, NCDs, and a particular focus on youth and young people. I've actually been heartened by all the panelists because a lot of the things that I'll be talking about have been picked up in previous presentations. But what I'd like to note is that there's needs to be more attention to surveillance and detection of the impact of climate on behavioural and environmental risk factors of NCDs. So NCDs cause 3/4 of all deaths in the Pacific region, and even in the Western Pacific, where infectious diseases remain very common. So what is clear is that the risk factors are worsening the burden of living with NCDs, and these overlap with climate-related health issues such as air quality and access to healthy foods. The consumption of highly processed and imported food items and sugar-sweetened beverages are some of the most common risk factors for NCDs in the region. So one of the key questions is, how do we reduce the reliance on highly processed food to more healthier traditional food, given land and water constraints and warming seas and ocean acidification? And how do we tailor efforts so that people with existing health conditions are not made worse under heat stress, and those particularly vulnerable to weather events and disruptions in food supply? There is currently a lot of work and research underway, but as discussed, some of the global measures, models, and indicators are not fit for purpose for the geographies across the Pacific. There is also a strong push from within the region to look at the past to move forward. And this has been done and led by SPREP, who are using traditional knowledge to support the development of environmental indicators and adaptation plans that build on traditional knowledge and the knowledge holders who have been living on land rather than focusing on, I guess, ill-informed prediction models. There is also current work looking at better prediction models, particularly for vector-borne diseases in the Western Pacific. At the recent Pacific Health Ministers meeting in Tuvalu this year, there are 3 key themes. So first was the leveraging the COVID-19 pandemic to build sustainable systems. The pandemic highlighted the vulnerability and fragility of health systems and facilities. And this also aligns to the WASH priorities, where the lack of access to basic water facilities hampered the Pacific's ability to combat the disease in many areas. The ministers have also reaffirmed the need to put health at the centre of climate change discussions, as well as accelerating action on NCDs. And in this way, the Pacific has reframed NCDs and climate change as twin crises. The ministers also note that there needs to be capacity to anticipate and respond to health and climate impacts. There needs to be the inclusion of health and national climate change adaptation plans. But also we need these adaptation plans to support Pacific communities to stay in place. And this is particularly important for our young people. There is also the need for more baseline data to inform robust service delivery and policy and legislation for maximum impact. To conclude, as I've mentioned, there is actually quite a bit of work being done on climate change at national levels and regional levels, but there's also still more work that needs to be done, particularly to support regional partners, national governments, and local communities. There is a lot of interest from development partners across the world to conduct research, but I think we just need to be cognizant of the capacity restraints of the public sector researchers and partners within the region. More work needs to be done to ensure that we have a steady pipeline of young Pacific researchers who can come up with solutions that benefit their future. I look forward to the work of the Centre, working together for collaborative impact and advocating for a co-design approach, particularly working with partners to advocate at a global level for fairer trade, environment and health outcomes for the Pacific region. Mahalo whawhitai, thank you.
Thank you, Rani. Thank you. Thank you so very. Thank you so much, Roani. And I see that you're not a slave to the PowerPoint. You're like I am. I can speak for myself. I really want to thank you for your presentation, and I really like the way you ended, where you spoke about putting health in the center of climate change, and that this has been a recognition of the policymakers in the Pacific Islands. And you spoke a lot to one of the issues that we also have in the Caribbean, and that is around capacity strengthening and making sure that, as you rightly said, we have a steady pipeline of young researchers who will help to come up with the solutions to the problems, and that we utilize co-design in our interventions. So thank you so much, Rani. That was an excellent presentation. And I'm going to move very swiftly to our next presenter. Our next presenter is Dr. Pablo, I'm trying to say it in Spanish, so it's not coming out right. Dr. Pablo Mendez Lazaro. I hope I did not butcher the Spanish right there. Dr. Pablo Mendez Lazaro is currently the leader of the Puerto Rico Climate and Health Research Group, PR-CLIMA, and he's an associate professor at the Department of Environmental Health at the University of Puerto Rico. He has studied all over the world, in Puerto Rico, in Spain, in the United States, and his areas of research include, and I'm just going to list a few, geography, marine sciences, environmental sciences, water resources, and climate change, extreme events, and one that I want to hear more from him of, and that is remote sensing. He has been in research for a long time. He's been analyzing climate and weather extreme events impacts on public health and resilience, and has quite a few publications in that area from Puerto Rico. He's also what I would call a specialist in the Caribbean in air pollution and Sahara dust. I'm not going to say too much more about Dr. Lazaro. I just want to add that he is the city co-lead in Urban Resilience, the Extreme Weather Events Sustainability Research Network. He's also a co-author of the US 4th National Climate Assessment, and that's NCA4 for the Caribbean region. And so he focused on Puerto Rico and the Virgin Islands in that report. So Dr. Pablo, over to you, please.
Thank you, Georgiana. First of all, thank you for inviting me to be here. This is an amazing experience. It has been all amazing presentation, what I'm seeing here. If you don't mind, I'm reading a message in my computer often that my internet apparently is like unstable. So can I stop the video? I will turn it on later also for the discussion, if you don't mind.
Oh, that's fine.
Okay, perfect. Can you see my presentation?
Yes, we can.
Okay, it's going to be a little bit complicated after all of the other speakers, amazing speaker that we had. But one of the things that we have learned, and we are listening very often, and we are reading also in the new Lancet report, are about the coexisting and the cascading effects, right? Most of these extreme events, I would say all of them, right, are interacting with the social determinant of health and the institutional conditions and the institutional context. So with this chaotic graphic or picture or slide, what I just wanted to show is how this, all of the different things are occurring simultaneously or one after another. So the intensity, the duration, and frequency of these extreme events are again interacting with financial crisis, political crisis, geological crisis, all other public health crisis as it happened with the COVID-19 and multiple other things, right? So to say the story short, I'm going to be using an example of what happened in Puerto Rico for the last couple of years, at least in 2017. So in 2017, Puerto Rico declared bankruptcy. And what happened is that was when we finally recognized that we were unable to provide enough maintenance to critical infrastructure and unable to keep going and running our economy, right? For so many years, because of corruptions and mismanagement of budget, we after all declared bankruptcy. But what happened is if with the dire infrastructure, with mismanagement and maintenance, we suffer two of the most major hurricanes ever faced in Puerto Rico in recent history. Let me clarify, right? Hurricane Maria and Hurricane Irma, right, in 2017. And they were powerful enough to almost destroy all the island, right? Because of that, thousands of people died, not during the landfall, but thousands of people died in the aftermath of Hurricane Maria. So the question is, what were the conditions and the situation and the reason why the people died, not during landfall, but in the aftermath, 2 weeks after, 1 month after, right? So those are the questions. I think that the National Hurricane Center and a lot of the different weather agencies are improving a lot on how to provide weather information to prepare yourself about the weather, extreme event that is coming, but we still need to work with other agencies in terms of preparedness for what is happening after, right? And so because of that, and the people get so anxious, there were a lot of political crises in Puerto Rico, and the first governor in Puerto Rico that ever resigned, it happened during the summer of 2019, meaning that the political decisions were more, were paying attention more to the instability in the island than on the recovery and rebuilding the island, right? And just a few months after, we suffered some earthquakes in the southwest of the island in January, in the winter of 2020. And just a couple of months after, when we were working on recovery and rebuilding because of the earthquakes and hurricane, everything was closed, everything, because of the pandemic that entered in Puerto Rico, the first cases during the spring of 2020. So the government declared lockdown and curfew, and most of the things that we were working on to rebuild Puerto Rico, they were stopped, right? So while we were dealing one of the most powerful viruses affecting the respiratory system, we also face in the Caribbean region the worst Saharan dust events that came to the Caribbean region, mainly coming from the Saharan Desert and the Sahel Desert, right? So it's coming from, like the hurricane, it's following exactly the same trajectory from the African continent, it's traveling all over the Atlantic, and we faced over 3 days with hazardous conditions due to air quality in Puerto Rico while we were dealing with a respiratory pandemic all over the island as well. And when we were asking for the people to protect themselves, to be more hygienic in their house and with their bodies, with their hands, almost 40% of the islands were dealing with water rationing because it was a drought. 70% of the island was facing a drought, and at least 40% of the different municipalities in the island were facing water rationing, right? So it was very complicated to deal with dust, to deal with a pandemic where we were asking to be more healthy and more hygiene, but there wasn't water to use, right? And then a couple of years after, we faced also Hurricane Fiona, which was only a Category 1, but a Category 1 that almost destroyed everything as it happened with Hurricane Maria, but not because of the power of the storm, but because of the dire situation and the way that we have been unable to rebuild the things that were destroyed before, right? And something that it was amazing, again, as I mentioned before, the people did not die during landfall with Hurricane Maria, the people did not die during landfall with Hurricane Fiona, but something that we're seeing is that after hurricanes, we are more, I will say, it's more frequent to see that you might face a heat extreme event or heat episode after hurricanes. So meaning that with the lack of energy, with the lack of green infrastructure that is able to provide you with shade and reducing or minimizing the extreme temperatures, with a lot of water sank because of the rainfall and flood in all the territories, but a lot of sunlight and energy. So the heat index is increasing so much that excessive heat is being issued by the local agencies and without energy, meaning that you don't have the technological adaptation to turn on your air conditionings or your whatever other kind of instrument that you might be able to use, right? And this is not new, right? So we have been seeing since 2018, at least from NASA and from other scientists that have published in one of the best journals, science journals available, that the combination between temperatures and humidity is the worst case scenario for human health, right? So heat is a silent killer, as very well known in the Northern Hemisphere and in the Northern and the Southern Hemisphere. But what is happening is also is that the combination of both, a lot of humidity, relative humidity, and with a lot of increasing temperature is increasing the heat index. And this could be lethal, right? Because it's not by sweating that your body is able to control or to reduce temperatures. It's by the evaporation on your skin that then your body will be able to control the temperature. So if there is a lot of humidity in the atmosphere, your body will not be able, or it will be more difficult to reduce your thermal comfort, right? Your temperature in your body, right? Because the sweat will stay in your skin. So that's one of the reasons why it's so important to consider heat, even though that is not considered a disaster. There is enough evidence to say that at least in the Caribbean region and islands are facing this kind of hazard. And there is at least some evidence suggesting that indeed, even in Puerto Rico, heat is also associated with mortality, hospital admissions, and emergency room visit, as it happened with many other places in the world. We are not superhumans, right? So if it's hot and it's a lot of humidity, heat index might increase, interacting with the social determinant of health and the people that are most vulnerable, right? And again, heat is also associated with the seasonal, with the season of summer, June, July, and August. But something that we might need to start to consider in the Caribbean region is that also heat, as I mentioned here, one of the manuscripts that we recently published, is that anomalous heat has been present after hurricanes. So meaning that in a catastrophic scenario where you don't have electricity, as the other colleague was talking, when you don't have green infrastructure because most of the trees were destroyed by powerful hurricanes and the canopies were destroyed and defoliated, so you don't have that ecosystem services where you have a lot of water available, able to evaporate with the sunlight and energy. So you might be facing again, in a dire situation, in a chaotic situation, extreme heat episodes. And we face exactly the same thing with Hurricane Fiona. As you can see here, these are some of the issues, of the warnings that issued the National Weather Service locally, that right after Hurricane Fiona, when most of the people were lacking of energy in Puerto Rico, we were facing also extreme heat episodes for almost 7 days, right? Another thing that is affecting in the Caribbean region, I will be very quickly with this is only two slides with it, is the Saharan dust that is arriving to the Caribbean. So these Saharan dust are are these particles that are arriving from the other side, following the same trajectory as hurricane, with the trade winds arriving to the Caribbean. And this particulate matter are obviously nutrients that can provide, that are beneficial for terrestrial ecosystem, marine ecosystem, and coastal ecosystem. But when we're talking about public health, this small particle can also be affecting the respiratory system and is associated in the Caribbean region with emergency room visit, hospitalization, and in some cases, and in certain degree, not in all cases, with death, right? But you need to have some kind of comorbidities and comorbidities that are to identify that you are probably most vulnerable to be affected also by the Saharan dust. And for those of you that live in the Caribbean region, and remember, as I mentioned before, in the summer of 2020, we suffered one of the worst Saharan dust event with 3 consecutive days, not only with COVID-19, but also with hazardous conditions in terms of air quality, affecting most likely public health in the Caribbean region. So the people in Puerto Rico were complaining about respiratory things, even though they were not affected by the virus, but they were also again complaining because of the condition, the environmental conditions that were affecting their health and their family members as well. And this is one of the pictures where we can see the size of the dust cloud, that it was almost covering the whole Caribbean region in terms of the eastern islands. And that's it. I just wanted to promote the discussion, and then we're willing to continue during the panel after. Thank you.
Thank you so much. And you touched on many things, including the Sahara dust. So thanks a lot for your presentation. And I had forgotten to mention that you were also doing a lot of work on the causes of death after an extreme event. And I think your research showed that there was a growth undercounting of deaths, of mortality after extreme events. So thanks for raising that. And thanks for your presentation, Dr. Lazaro. Thank you so very much. We're going to move along, and to give us a perspective from the physician, we have with us, we're very, very fortunate to have with us today, Dr. Paula Henry. And Dr. Paula Henry is representing the Caribbean College of Family Physicians. She is the climate change expert, and she's going to tell me, no, I should not use the word expert, but she's a climate change guru in that group, and she has been advocating night and day for increased visibility on climate change and health. And also she has been trying to run educational programs for the physicians, because she thinks you have to start from perspective of knowledge. I'm going to just say a little bit more about her, because you saw her earlier. She was a person in the video talking about the floods in Trinidad. And I'm just going to give you a quick rundown of her credentials. So Dr. Paula Henry is also a member of the Trinidad and Tobago Medical Association and the Medical Board of Trinidad and Tobago and the American Academy of Family Physicians. Her passion is for the environment and for alleviating the negative impacts of climate change and pollution on human health. And this has led her to become a member of both the Working Party for the Environment in the Caribbean region and the Working Party for Women and Family Medicine in the Caribbean. This includes work which relates to issues of vector-borne diseases and nutritional deficiencies which are associated with extreme events such as floods and droughts. She has deep empathy, especially for those who are downtrodden, and she's especially fond of young people and of their right to express themselves and to have agency. And she finds practical expression in the vast number of organizations in which she is involved. And I will say for sure it is a vast number of organizations. She went to Haiti during the devastating earthquake as a physician and as a part of a medical team. And that was a great experience for her. She was able to operate as a family physician and an emergency medicine physician all in one at that one time. So I'm going to hand over to Dr. Paula Henry to give us a perspective from the clinical fraternity or the medical fraternity. Thanks, Paula. Please go ahead.
Thank you so much, Georgiana, and hello to everyone. I can say good evening, good night, good morning for us, New Zealand. Thanks for having me. Let me share my slides. Okay, I will try to keep to time. And let me just say that we have heard so much today that I'm going to try to just highlight a few points because in the interest of time. Okay, so we have heard so much about heat and air pollution, hurricanes, but I just want to highlight a few of the things that we need to highlight. And that is, we have to think that climate factors cause different medical conditions. So when we talk about heat, and Dr. Pablo just spoke about this, we have to think about heart attacks and kidney disease, simply because they cause different things. So in heart attacks, we have plaque vulnerability and ischemic heart disease and stroke. And with kidney disease, what we find is because we have a lot of the volume is getting lost because of heat, we go into a situation whereby the patient actually loses a lot of their volume and they go into acute kidney failure. We also learned a lot about air pollution just now with the Saharan dust event, the Godzilla effect that Dr. Pablo spoke about, and that was in June of 2020, and people suffered a lot of allergies, asthma, and COPD. And now we are learning a lot about cancers, where we are getting PM 2.5 being associated with lung cancers. And those lung cancers we are seeing in women who are non-smokers. Of course, hurricanes, we all know about that. But now we have to consider the mental health impacts of hurricanes, because we just had COVID-19, and COVID-19 causes mental health impacts, anxiety, depression, gender-based violence. And now with the intersection of COVID-19 and climate change, we are seeing even worse impacts in mental health. Flooding, we talked a lot about infectious diseases, so I would not go into that, but I will mention a little bit about nutritional disorders just now. And of course, storm surges, because we see that in SIDs, in small island developing states, in the Caribbean, as well as in the Pacific. We are seeing storm surges now associated with hurricanes and sea level rise. I want to mention this because, you know, the sea has a lot of salt. So when we have sea level rise, we have the groundwater being salinated, and that is causing right now increases in hypertension, and hypertension also in pregnant women. We know about sewage contamination and access to clean water, so I'm not going to talk about that. And of course, drought. We know that because of drought, we now have increased climate migrants, and that is increasing both economic and social disparities. Okay, so why is my slide not advancing? Okay, yes, so I mentioned this because I'm talking about the health aspect. And I'm mentioning air pollution because this is causing a lot of, we see here, right, cardiovascular disease is taking a giant share of things. And in cardiovascular disease, we see people are being dying from ischemic heart disease. We talk about plaque vulnerability and heart attacks, but we're also having increases in strokes. We talk about chronic pulmonary diseases like asthma and cancers. We talked about lung cancers, and of course, diabetes. But this is very dear to my heart. And this is because of air pollution. And as we see here, this is the developing fetus. And this is the cord blood here. PM 2.5 is getting through the lungs into the blood system, coming through the cord blood, getting into the developing fetus. And as primary care physicians, we say, where is the damage being done most? In the vulnerable populations, we are going to have now premature birth, low birth weight babies, and damage to almost all the organs of the developing fetus, leading to impaired cognitive development and poor quality of life after birth. And I just want to mention here, again, we talked about the pregnant woman, but we need to talk a little bit about low and middle income countries. Why? Because of poverty. Poverty being caused by malnutrition, and malnutrition being caused by, let's think about it. In climate change, we have the loss of our pollinators, and we need our pollinators to cross-fertilize and produce our fruit and vegetables. If we're not having fruit and vegetables, we are having poor dietary practices. Another thing that people may not be aware of is that, okay, so Harry mentioned that 94% of our fossil fuel production is used for energy production. Well, when we burn fossil fuels, we are causing a lot of carbon to go into the atmosphere. And in situations like Trinidad and Tobago, where we use fossil fuels, we have a lot of carbon in ambient air. High carbon in ambient air means that our fruit and vegetables and our plants now have high carbon, a high carbohydrate content. High carbohydrate content means less protein, less zinc, less folate, and of course, less iron. And less iron is associated with the anemia that we are seeing in lower and middle income countries. And I mentioned here the younger population, only to mention it and to pass it by. Why? Because we now have a younger population and they have different dietary requirements. They now need more iron because they're developing. Okay, did I go miss one? Okay, and okay, now the intersection between climate change and demographics. We had talked about increased population, and because of that, we talk about urbanization. Dr. Michael mentioned urbanization. She showed us a lot of colonial houses, greenery, but a lot of urbanization has to do with urban sprawl. And we know that urban sprawl means that we have a lot of concrete. A lot of concrete means that we're not, when we get a lot of rain, we have a lot of flooding. So we know what that means. We are causing increase in our infectious diseases, and we have heard a lot about that. Of course, climate migrants. So let's move right along. Okay, so one of the things that we have been doing in the Caribbean is that we have been developing smart hospitals, and CAIHR is helping us with that. They are giving us technical support. Right now, we have CAIHR hospitals in St. Vincent and the Grenadines, Guyana. And what do we mean by smart hospitals? Well, basically, we mean safe. It means that they are going to be resilient. They're going to be operating during times of climate disasters. Smart means they're sustainable. And green. Green means that we are now trying to decrease our carbon footprint. The health sector is consuming, or it's using up 4.6%, is producing 4.6% of greenhouse gases. And we have to do something about that. So Harry, again, will probably be happy to know. He spoke a lot about the fact that 94% of our electricity generation is coming from fossil fuels. Well, in Belize, where they are putting these CAIHR hospitals into practice, 75% they did audits on 3 hospitals, and they decreased the energy bill by 75%. That's good news. So what are we going to do? What should we do as primary care physicians? Well, we should be getting involved in, you can read it, leadership, information, financing, service delivery, increasing our workforce community. And I put it here just so that we can remember. So in leadership and governance, we should be developing our national adaptation plans. We need to educate our communities. We need more information. So it means that we need to have surveillance. We need to have more epidemiological studies and cloud-based medical records. We need financing. We know that we should be getting more financing, yes, from governments in the more developed countries, but also from like the Green Fund, where we can use to develop our initiatives. The service delivery component, we talked about our supply chains in food, the development of our health workforce, the importance of our continuing medical education and introducing medical education into medical schools. This is something we have to do in the Caribbean. And so in conclusion, you just have to remember 3 points: that different climate factors affect different manifestations of health differently, that we need to have smart health facilities so that we can become climate resistant, and that should be now normative, not only in the Caribbean, not only globally, but in the Caribbean, and that we need all hands on deck to find solution to the climate crisis. Thank you for listening. It's the way we're going to have a happy, healthy population.
Thank you. Thank you so very much, Paula. Thank you, Dr. Henry. Your presentation was quite comprehensive, and I like that you ended with some possible solutions and giving us ideas on how we might address the issues that are facing us. I'm going to, because the discussion and the presentations have been so rich, we're running a little bit over time. So I'm going to try to pull it together, which means we're not going to have a long time to have a discussion. But I thought that I should at least raise some of the questions, or at least one question that was posed in the question and answer. And this question was posed by, one second. It was posed by Aldith Buckland, and it was directed to Professor Michael. Professor Michael, are you still here? And she's asking you to expand a bit more on the compact urban form that you spoke about in your presentation.
Thank you, Dr. Gordon. What I was referring to in terms of compact urban form was that I think Dr. Henry made reference to it, in that we are seeing a lot of urban sprawl. That is, urban sprawl is where you are leaping away from the core city and opening development up to agricultural areas. So that we've lost agricultural land, but we are also seeing that it becomes inefficient. There are what you call agglomeration externalities when you keep moving away from the main locus of activity, which is your urban center. So let me address the question specifically. Compact urban form, and a lot of European cities are actually more compact. They have medium, we don't need to go high density because we're small island developing states, and high density development, unless you're living in Hong Kong and Singapore. And that has its psychological stress, let me tell you, having lived there myself in Singapore. We should really try to move towards not low density, but medium density housing, where you sort of put a belt around the capital and try to go vertically as opposed to horizontally, where you will get the sprawl issue. With compact urban form as well, you tend to have more efficiency in infrastructure provision, because the minute you're talking about sprawl, it means all your water lines, all your road infrastructure has to go in a linear extension to meet these settlements that are off the grid, so to speak, because they're greenfield developments. Whereas if it's compact, you already have an infrastructure base upon which you can develop. I hope that I have answered the question posed by the person who has asked that specific question.
Thank you, Professor Michael. I think you have it. It's clear to me, so I hope it's also clear to Aldith Buckland. I have one question for Roani, and that question is about heat adaptation. So Roani, you spoke a little bit about how in the Pacific you're looking at traditional solutions to address future problems, and I wondered if you could speak a little bit more about what some of those traditional solutions are.
Thanks. So I think one of the things that they're looking at is going back to traditional housing. Yeah, so kind of housing that, I guess the good and the bad is that in terms of heat adaptation, the circulation of air is really good, but the problem is that when there's cyclones, then they're not that stable. So in the interim, though, there is some new technology that we are looking at introducing in the region, that we're working with a supplier to put on the roofs of houses across the region, and working with the National Meteorological Offices to measure the impact of this new technology called cool roofs on bringing down heat, particularly for, well, I guess overnight. And so we're using Fitbits and other kind of monitoring devices to see how that impacts on things like resting heart rates and I guess other indicators like that. Does that kind of answer the question a little bit?
Yes, thanks. Yes, thanks, Joanne. All right, so I have another question, and this question is for Harry. In your presentation, you looked at access to electricity, and I wondered if you could tell us a little bit about what you think are the priorities for SIDS nations in terms of maximizing health in the face of, for us, energy, inadequate energy or insufficient energy or energy insecurity, I think is the correct term, and climate change.
Thanks very much, Georgiana. Yeah, I suppose it's worth following up a little bit on that sort of association I made between electricity access, I should say, and life expectancy. That's obviously very complex and mediated by lots of things. And one of the important things that I don't think have mentioned is if you have access to clean fuels, so that's things like electricity, or in certain contexts, propane in the households for cooking, you can reduce your exposure to air pollution, household air pollution, compared to when you use biomass. So particularly for countries, ones which use a lot of traditional biomass, like Guinea-Bissau, which I mentioned in my presentation, that's somewhere where there's a real priority for a sort of double win. You can increase if you can increase access to electricity, then you stand to gain not only the advantages of having things like being able to use lighting further in the evening, you also can improve indoor air environments so that you really get lots of compounding wins. And then at the same time, you stand to do that in a way which is compatible with climate change. So that's the sort of broad thoughts I have on that. Thanks, Georgiana.
Thank you. You're welcome. And so I have another question for Dr. Pablo Mendez-Lizarro. Pablo, I thought you would just give us a little bit more information on some of the new efforts that you have been attempting in building climate adaptation partnerships.
Yeah, thank you, Georgiana. So we strongly believe that one of the most powerful things, and I think that someone mentioned it also here, one of the speakers, is that using human-centered design, also co-design and knowledge co-production. So we strongly believe that there's a lot of knowledge in the traditional communities, in underserved communities and disadvantaged communities that for certain reasons are not being recognized in most of our countries, right? So we are building this climate adaptation network to work between Puerto Rico and the US Virgin Islands, the 3 different islands. So mainly working with the territories of the United States that are in the Caribbean region to develop this adaptation network, working together with practitioners, government agencies, but also community-based organizations since the very first beginning. Because as I mentioned, what we're using is a human-centered design, and a human-centered design means that you start working with the people most affected by the problem to be solved. And in most of the cases are people and communities, they have the solution, they have the knowledge, and they know what they need, right? But the issue is that they lack of access to resources, and they lack of access to budget, they lack of access to decision-making activities. Those are the kind of things that we are trying to provide in order to improve how the things are going right now, right?
Yeah. All right. Okay. All right. Thank you so much, Pablo. I have another question for Rani. Rani, this question is coming from Sharon Biribo, and Sharon is from the School of Medicine at University of Fiji. And her question is, would you be able to share a website or link to the Pacific Islands arm of the project, especially dealing with the traditional solutions?
Sure, I can do that. I'll put it in the chat.
Okay, all right, thank you, Sharon. That was an easy answer, and Rani will put it in the chat. You can just have a look in the chat to see, to pull it from the chat. I have one more question, and that is for Professor Tanisha Stevenson. Prof?
Yes.
Make sure you're still here. Thank you for still being here. I know I think you have another engagement, but I wanted to just ask you a little bit about some of the climate reports that have been done, the state of the climate report for the Caribbean and the state of the climate report for Jamaica. I know that the climate projection is more or less the same, and it's what you actually said, but I wondered if you could maybe speak a little bit to the intersection between climate change and I'm going to put you on the spot. I'm not going to ask you specifically about health. I want to ask you about droughts and food security. I wondered if you could just maybe say a few words on that.
Okay, thanks so much, Georgiana. So for colleagues who may not be familiar with the reports, we have published a State of the Caribbean Climate Report that is a summary of the state of the knowledge we have on climate change variability for the Caribbean, historical climate change for the Caribbean, what is projected for the Caribbean with respect to future climate change, and zoning in on borrowing member countries of the Caribbean Development Bank. They sponsor the report, and also looking at implications for different sectors. And we would also have had chapters that treated with climate services and the opportunities that presents with respect to responding to climate. With respect to drought, and a similar report was done for Jamaica. We're on the 3rd volume of Jamaica's version of the State of the Jamaica Climate Report. So some of the outcomes with respect to droughts would have been pretty much as have already been presented, that we have seen more frequent drought events. Particularly, we have noted the 2009-10 drought event, and there was a pan-Caribbean drought event between 2013 and 2016. So while the science isn't conclusive that we have significant trends in drought occurrences and severity, we have had significant events over the last decade. And yes, this has had implications for food security. You're speaking to yield, amount of yield, quality of yield. You're speaking to crops, you're speaking to livestock. And so the report would bring to bear different stressors that come to bear when we speak to climate change and food security. And some of the responses possible where we try to treat with food security in this context. It would also speak to opportunities that are underway with respect to climate, agricultural modeling, so that persons can better prepare. And it would speak to tools, because we have increasingly more tools available for even for farmers on the ground to be able to predict yield given certain climate scenarios or weather scenarios.
Okay, all right, thank you so much, Paul. I think that we have overshot our time, and I should apologize for that. I think I wasn't such a great timekeeper because I got so enthralled with the presentations which were being done. So I want us to maybe get to the point where we will wrap up. We want to use this opportunity to officially launch the Regional Center for Small Island Developing States. And the symbol that we will use for this launch, and Stephanie, I hope you're ready, is our logo. So we're just going to do a reveal of our logos. So you will see that the logo is similar to the Lancet Countdown logo. So we had to use the same kind of pattern, but we have our blue ocean and our little green island in the middle of the usual Lancet Countdown logo. So whenever you see this and you see a little island in the middle, you will know that it represents the Small Island Developing States. And the Lancet, it represents the Lancet Countdown, it's Regional Center for Health and Climate Change for Small Island Developing States. So round of applause, please. Thank you. Thank you, and thank you, Karen. All right, so I want to wrap up because I know that especially Harry and some of our other colleagues from the Lancet Countdown on the UK side of the world are still with us, and it's pretty late for them. So I wanted to just wrap up, and I want to thank you all, especially the panelists, for speaking. I'm very, very happy that we were able to get such an excellent array of experts, and I'm hopeful that we will be able to collaborate with you all in the future in work that we would like to do as we go forward. For those who are attendees online and would also like to be a part of the network, we would ask you to just drop your email in the chat, and we will save the chat afterwards so that we can get in touch with you directly. So I'm now going to hand over to our official chair, Professor Suzanne Walker, to do a few closing remarks, and then we'll end the webinar. Thank you.
Well, thanks, George. Thanks, Georgiana. I think you did quite a good job of wrapping up already, but just to say we're now at the end of a really interesting and informative program. And I would like to reinforce how pleased we are at the University of the West Indies and at CAIHR to be the hosts for the Centre on behalf of small island states across the world. And we look forward to the Centre's work as it documents the impact of climate on health in SIDS and generates evidence on mitigation. And it was really good to see the policy brief as an early output. I'd like to thank our collaborating partners at University College London, and we look forward to working together. And thanks, as Georgiana has already expressed, many, many thanks to our panelists, and we look forward again to continued collaboration. And finally, thanks to the audience for joining us, and we hope you'll remain engaged with the work of the Centre. And I encourage you to access the 2022 Lancet report on climate change and health, and also the policy brief for climate change and health in SIDS. Thanks to you all for sticking with us, and we look forward to engaging with you again. Bye-bye.